Hi guys! Today I wanted to talk a little bit briefly about psychosis. So psychosis is a disorder where a person will experience things such as hallucinations and delusions. So hallucinations may be that they are imagining or seeing things that are not actually there, and delusions might be that they believe things that are not actually there, that are happening or that have happened to them. I wanted to talk about psychosis because it can crop up for people. It can be part of mental illness. It can also occur when we aren't medicated or when a person is not medicated for a mental illness. And other times, sometimes medication can cause psychosis. So I think it's an important topic to quickly discuss. And what are some of the symptoms of psychosis? How might you know if you're experiencing it or if someone you know is experiencing psychosis? So some of the symptoms of psychosis are difficulty concentrating, having a depressed mood. If you're sleeping a lot or you're not sleeping at all, that can occur when a person is experiencing or is having a phase where they might be psychotic. Sometimes anxiety is a big factor. Anxiety can fuel a lot of mental illnesses, and it can fuel a lot of processes in our body and in our brain. So anxiety can be a trigger for symptoms of psychosis. Suspiciousness is another one. If you or someone you know is suddenly becoming suspicious of people around them or is finding that you're overly suspicious, that can be a sign of psychosis. And another really key factor here is if you're withdrawing a lot from your family, your friends, people who are close to you, and if some of that suspiciousness is directed towards them, that can be another symptom. Like I had mentioned earlier, delusions and hallucinations. So the delusion piece is more the thought process and the actual belief that things are happening that are not happening. The hallucination factor is in with the sensory experience that we actually see, hear, feel, smell, or in some way have a sensory experience that is not actually true. In a sense, it feels true for us, but it's not actually real. Being depressed, having suicidal thoughts and actions, that is another sign that there might be some psychosis going on for someone. And also just if they're talking to you and they're really scattered and just disorganized, what they're saying doesn't make a lot of sense, that's another symptom for me that someone might be experiencing a psychosis. While psychosis can be triggered by mental illness, there are also environmental factors that can trigger it for us. So things like drug use, heavy drug use over a long period of time and then stopping can cause psychosis. Some people react really badly to certain drugs as well. So be really aware of drug use if you are someone who's prone to episodes of psychosis or if you have a history of mental illness. And also the other one is if you don't get enough sleep or if you're overtired, really stressed and just not coping well, that can cause psychotic episodes. As well as experiences of trauma, I believe, can cause kind of these delusions and abnormal perceptions as well. And I do talk about that in some of my other videos. There are also certain, when I talk about environmental factors, certain illnesses that if you are really unwell or really sick physically, even certain brain diseases like Parkinson's, that can cause psychotic episodes. So that would not necessarily be classed as a mental illness, but it can sometimes be clumped in with certain diseases that cause psychotic or psychosis type behavior. The other ones are things like brain tumors, stroke, many things that affect kind of our brain and our body function. And the main mental illnesses that we see psychosis as part of the symptomatic makeup of that specific illness are bipolar and schizophrenia. Those are the two that come to mind, but like I say, it can come on in other ways and even with things like anxiety. If you are experiencing symptoms of psychosis, I would say seek help from a mental health therapist or from a professional, a doctor, a psychiatrist, someone who can help you, because psychosis is a really severe symptom, and I really advise people not to leave it and not to just let it go on for long periods of time. You would have to be diagnosed through a psychiatric evaluation for psychosis. And also sometimes they'll do even brain scans or x-rays to figure out, is there something else going on for this person that's causing this kind of strange behavior for them, or a difference in behavior that is not normal for them. And I always recommend for treatment options, especially with psychosis, it may be necessary to medicate yourself and seek a therapeutic treatment option. So don't hesitate to seek out therapy. We always want to work on our triggers and what causes our mental health symptoms in therapy and work on the brain process. But if you are having severe psychosis with hallucinations or delusions, you might need some kind of tranquilization. You may need to have some type of medication to help you overcome those symptoms.